Welcome to Health and Wellness on BCCTV.
A lot of us are walking around with extremely high blood pressure, and this can come from stress, it comes from our diet.
Think about your sugar control like that. You eat something, your sugar is there in the blood, you need insulin, so okay.
Hello everyone, my name is Isoken Ogbomo. I am live on Black Community Television. I am a family nurse practitioner by profession. My specialty is adults with families, and I've been practicing for the past 6-7 years, but I've been in the healthcare industry for more than 20 years. And I'm here today to talk to you about preventive health amongst African community. One of the things I have observed in my experience in this industry is that most indigenous folks in where we live, whether it's Canada or United States, have really well established preventive healthcare system. It is unfortunate to some extent that us who may be immigrants or even indigenous African Americans or Asians or Jamaicans, most times preventive health is not our focus. So we always think of when situations happen and when sickness occurs that we seek some help. But I want to challenge us in this topic today, in this conversation today, to begin to think from a different perspective when it comes to your health. Health, they say, is wealth. We have to be healthy in order to fulfill our purpose on earth, in order to do what God has placed us to accomplish here on earth. So it makes sense to be proactive versus being reactive when it comes to our health. We may have tons of ideas about things that we want to accomplish. We may have bills to pay. We may have responsibilities from back home. And health tends to be the last thing on our consciousness. And I want to change that. I want to challenge us to change that perspective today. To begin to know that health should be a top priority, because when at the end of the day, when everything else is said and done, if you cannot move with your physical body, if you cannot accomplish much with your physical body, there's really nothing you could do. There's really not, your results are going to be limited. And so I want to really challenge us to see things from a different perspective. And what is preventive health? Preventive health is taking proactive approach to health. Proactive approach means seeing a provider, seeing your doctor prior to having any form of sickness, catching symptoms early, and taking actions to fix those symptoms during the early stage is the best, provides the best outcome. So what are the different types of preventive health that we can do? Before I talk about those specific detail, I know in most cities and in North America, preventive health, it tends to be covered at 100% of the insurance. So it's not something that you necessarily have to incur lots of cost to accomplish. So this should not limit us from taking action. So just check with your insurance, check with the local community health clinic, and ask questions about preventive health. So the first preventive health is to take action by scheduling your annual wellness exam. Annual wellness exam is a comprehensive exam where your provider will do a head-to-toe assessment, ask some questions in terms of symptoms, and then they can order some lab work to just check on your daily check values that may indicate something starting to happen, or if there's already something happening, right? Those we can find out from your blood test. So when you go in, your provider would at the bare minimum check your blood pressure. A lot of us are walking around with extremely high blood pressure, and this can come from stress, it comes from our diet, it comes from inactivity. It can also be genetic. So your provider could check your blood pressure, and most times blood pressure are not necessarily diagnosed on the spot. It is a trend that matters. So when a blood pressure is elevated in a provider's office, the provider usually will ask you to repeat that test, that blood pressure at 2 different occasions outside of the office. If those numbers are still elevated, then it means that you could possibly be diagnosed with hypertension. Another common chronic conditions that we have to be aware of is diabetes. Diabetes is when the doctor will do a blood test to check what we call A1C. Hemoglobin A1C tests the average blood sugar in a 3 to 4 month period. So it's not a spot check. So whether you've eaten everything that day prior to that test being done or not doesn't affect it. That number needs to be at a minimum less than 6.5%. So you want to know that number. You want to request for your sugar levels to be tested, especially given our diet very high in carbohydrate. Also, a lot of people have family members that suffer from diabetes. If there's a genetic factors, you extremely want to do this. Somebody could ask, what age should we start doing preventive care? I highly strongly recommend 35. But looking at a lot of folks now with weight issues, obesity as a prime factor for chronic conditions, I strongly do recommend that we should start even earlier, as early as 30, especially for men, because most women in that age, they're childbearing, and so they do see their provider frequently, and things can be catched frequently. So checking those 2 things are very important. Your cholesterol level at the very basic level, need to know what your cholesterol level is. And lastly, for men, you need to know what your PSA is, which is your prostate testing, checking to see if there's a prostate enlargement. Very significant number of African Americans or black men suffer from prostate enlargement or even prostate cancer. And one way to do this is to check your PSA. So I encourage you to ask your provider to check your PSA. Usually we start at the age of 50. If you are less than 50 and there's a family history, it is recommended to start even earlier. And for those other things that are age limited, breast cancer screening, which is your mammogram, ideal for women from the age of 40. However, if you do have a family history of breast cancer or any type of cancer, it is highly recommended that you start your mammogram earlier. Always have a good conversation with your provider. And I want to also begin to challenge us to take, in taking proactive approach, I want to challenge us to be more engaged with your provider. What does that mean to be engaged? It means to ask questions, and it means to be responsible for those numbers. I encounter a lot of people and I ask them, so what was your cholesterol? Oh, I don't know. The doctor said it was good. What does good mean, right? You want to know what that number is. You want to ask the doctor, what is my number? What are the normal range? So you know where you fall. If you're normal and you're starting to inch towards the abnormal range, you want to know that so you can take action, right? Another reason why you need to know the numbers is to monitor the trend. If last year you went in for your annual wellness checkup, your A1C was 6.4, right? And then the following year, your A1C is 6, you're doing something good. It encourages you to keep doing what you're doing because you're making progress in the right direction, right? We want that number to be as low as possible. So I challenge us to take active and engaged approach. Some of us feel intimidated by providers. Some of us think you can challenge a provider. I do disagree. This is your body, this is your health. You do need to ask questions. You do need to get a copy of your lab results. Save that copy, have a file, and check the trends. I have my results from 6 years ago, right, when I actually started doing it more frequently. I have those numbers, and I can refer to them, and I've seen the trend. Some numbers are progressing even better, and some numbers are not, right? So these things will happen, but you have to be aware. Awareness brings solutions, and awareness brings results. It encourages you to take action. So from everything we've talked today, this is very basic, but I think it's really relevant for most of us at the very basic level to know what your blood pressure ranges are, to know what your sugar levels are, to be aware of your cholesterol, right, and the trends, which means you're comparing from one year to the other, and also as for men to check your prostate antigens, which is the PSA, right, and for us women to make sure you start doing your mammogram as early as 40. So I hope this will help someone today. Please call your provider if you have not had a wellness checkup yet. Please do so and call your provider as soon as possible. Get one done. Same time, same month, same year, every single year. So if you did it in April, just continue to do it every April. Walk around, make it work for you, make it work for your schedule. Do not put your health in a back burner. You begin to see health as a proactive way to live as long as humanly possible, right? But also be proactive in being engaged with your provider. Ask questions and know what your numbers are, okay? It is not extremely difficult. People just blank out when it comes to numbers. But the purpose of knowing the numbers is not to memorize it, it's to know the trends, right? You want to see if things are increasing or decreasing. So thank you so much for listening to me today. Again, my name is Isoken Ogbomo. I'm a family nurse practitioner, practice in the Chicagoland area, and it's been a pleasure to speak with you today about preventive health. Take care.